Assalamu alaikum, dear brothers, sisters, all my elders, all my teachers, all my friends. This is Dr. Shehzad Arshad, the chairman and CEO of Neuropsychology Center, one of the leading neuropsychology center in the country, running and serving the community since past more than 2 decades. It's a public service message being given on behalf of Neuropsychology Center, NPC Pakistan, in the best interest of the health of the community. Today the topic what we are going to discuss is a very important topic, and that is suicide. As we all know that the percentage of the suicide all over the world and especially in Southeast Asia is growing more and more, and I believe this is a very important subject and a very important topic to be discussed and a very important message to be given about it. So basic awareness about suicide and its risk factors should be given to the community. So on behalf of Neuropsychology Center Pakistan, I would like to say a few words about suicide. Suicide risk is a complex, multifaceted issues involving a combination of behavioral, environmental, and health factors rather than a single cause. The key indicators include previous suicide attempts, untreated mental health conditions. Example are the depression, which is topmost. Then is the bipolar disorder. Then very important point is substance abuse which is very common in this part of the world, hopelessness, and access to lethal means. So please keep in mind, access to lethal means is a very important point when we talk about suicide. With a higher risk observed in individuals facing intense, like emotional, financial, or it may be social crisis. So these are different types of crises in which a person, a male or a female, a young adult, whosoever it is, may think or perform the act of suicide. So dear brothers and sisters, the key factors are suicide is influenced by converging factors throughout a person's life. One is previous suicide attempts. The most significant predictor of future risk. Number 2 is mental health conditions, in which we would like to say depression, anxiety disorders, bipolar disorders, schizophrenia, and PTSD. So these are important in mental health conditions. Then comes the substance use disorder, which, as I have already mentioned, is very common in this part of the world. So alcohol is one of the main issue, and other drugs misuse, drugs misuse, many drugs. It can be ice, it can be cocaine, it can be marijuana, and there are a list of drugs that can be misused, and that can increase impulsivity and worsen negative emotions, which can eventually lead towards suicide. Then is the environmental and life stresses, financial, legal, or job problems, loss of relationships, social isolation, or traumatic experiences. These all can contribute to the suicide attempt. Then is the physical health condition, which includes the chronic pain, terminal illness, or severe debilitating injuries. These physical health conditions may also lead towards suicide. And then finally is the social and cultural factors, that is exposure to peer family suicidal behavior, lack of access to mental health care. This is very important. Lack of access to mental health care. So access should be given, either it may be a child or it may be an adult. So access should be given to a mental health care, otherwise it may lead towards suicide. Or trauma or bullying, especially in children. Now I'd like to talk about what are the warning signs of immediate danger. So the behavioral changes can be seen. In behavioral changes, what we can say that searching for lethal methods. If a person is searching for lethal methods, it's a very big question mark. Withdrawing from loved ones. If a person is withdrawing from the loved ones, so there is a big question mark again. Increasing substance use. If a person was taking like comparatively less substance and now a person is taking, it may be a child, it may be adult, if he or she is taking more substance as compared to what he or she was, that again is a big question mark. And finally is the giving away of possessions. If you see someone who is giving away his possessions, that very clearly indicates that thoughts of suicides are coming in the mind of that person. Then are the verbal indicators. So please note that verbal indicators are also very important. That is, expressing feeling trapped, being a burden to others, unbearable pain, or expressing a desire to die. So if a person is expressing desire to die, which means that he or she is at least planning of doing suicide. So these are the indicators. One more is the emotional state, extreme mood swings, intense anger, rage, or profound hopelessness. So if you see in any person these signs, extreme mood swings, intense anger, rage, or profound hopelessness, you should immediately see a big question mark that a person may be going towards doing the act of suicide. Now is the risk assessment and support. Suicide risk is generally assessed by professionals through a 5-step evaluation, including assessing risk factors, identifying protective factors, example, strong social support, coping skills, and determining the level of the risk. If you or someone you know is in crisis, seek help immediately. I will repeat, if you or someone you know is in crisis, seek help immediately. So for that you may contact a suicide and crisis hotline. And internationally find a helpline to find support services in your country, wheresoever you are. Or consult a professional, consult a psychologist, consult a psychiatrist, consult an internist, consult a professional, or find a helpline, wheresoever you are. Because time is important. If you lose time, then things may go away. And once it's gone forever. So what are the key demographic and social trends? Suicide is a major issue among 15 years to 29 years olds. I will repeat, Suicide is a major issue among 15 to 29 years old, being the third leading cause of death in this group. I will repeat, suicide is the third leading cause of death in the age group between 15 to 29. Over 70% of the global suicides occur in low and multiple and middle income countries. This is very important. 70%, which is a very big number what we are talking about. The risk of the suicide is significantly higher in individuals with certain psychiatric conditions, which is about 5 to 8%. And then finally is the social isolation, OR, that is 4.0, and unemployment, OR, that is 3.8, are recognized as the strong risk factors in adults. So dear brothers, sisters and friends, this is a public service message on behalf of Neuropsychology Center Pakistan, and I would like to say that for your loved ones, for your dear ones, please take care of all these conditions, all these signs, all these symptoms what I have just mentioned, and time is very important in reacting. For any help, you may please call or contact or visit our website www.npcpakistan.org. I repeat, www.npcpakistan.org. This was Dr. Shahzad Arshad, the chairman of CEO of Neuropsychology Center Pakistan. May Allah bless you all. Long live Pakistan.